Do business, act business. Business
The use of ICT has the potential to promote patient-centered healthcare at a lower cost, improve quality of care and information sharing, as well as educate health professionals and patients, which also encourages a new form of relationship between the patients and their health providers. Welcome to Business Matters, where business truly matters. My name is Stephen Ipalbo Lawson.
Business matters. Let's talk business.
Nigerian health indices is one that needs to be attended to immediately, because that not just only affects our GDP, but it certainly affects the quality of life the citizens themselves are exposed to. Let us have a business update.
Business matters.
As is our culture or tradition, as you might want to say, on Business Matters, where we invite a distinguished professional to help us do justice to the topic of the day. And today's topic, we are looking at ICT impact on health sector. And joining me in the studio is no other person than a distinguished academic and currently a lecturer in the Department of Biomedical Engineering, University of Lagos, here in Nigeria. He holds a first degree in electrical electronic engineering and has two master's degrees, one in project management technology and the other in electrical electronics engineering. He also has a PhD degree in industrial production engineering. He's a registered engineer and a member of the Nigerian Society of Engineers with over 8 years extensive industry experience in designing, maintaining, and managing IT systems, hardware, and networks. He teaches and conducts research in broad areas of ICT and health informatics. He has received extensive training in biomedical and health systems engineering both in Nigeria, the United States of America, and South Africa, mostly funded by the U.S. National Institute of Health and Building Research and Innovation in Nigerian Science, which is BRAINS. He is obviously a man who has won several excellent paper award, especially at the International Institute of Engineers and Researchers International Conference in Dubai sometime in 2015. He is also a co-investigator on a grant by Pfizer research grant on using telemedicine to bridge the gap in the diagnosis and management of invasive fungal infections, as a matter of fact, here in Nigeria. He has two works that are obviously patented, and definitely is a man who has obviously demonstrated that the passion in biomedical engineering is something we must obviously embrace. Please join me as I make welcome Dr. Solomon NWANERI. How are you, sir?
I'm fine, thank you.
It's good to have you on Business Matters.
Thank you very much.
I mean, we look at the health sector, and there's so much that it goes on in that particular industry. A lot of people are so much concerned with the fact that our health indexes, or our health indexes, as you might want to put it, definitely is a far cry for what the standard is. And then you are a lecturer, no doubt about that, but a biomedical engineer as well, so to speak. We see how biomedical engineering innovation actually helps to bridge the gap. In your own general view, do you think we've done so well in terms of adopting or adapting ICT platforms in our health sector?
Well, thank you very much for that question. Based on the experiences I have had over the years, I've realized that in comparison with what is obtainable in other countries, we have not done so much, but there is a great room for improvement, considering that our expenditure on ICT in healthcare is still very low as compared to other countries of the world. So I think we can do better. The government needs to do better.
We should do better because a healthy nation is a wealthy nation. There is no doubt about that. You are a researcher who have seen so much of the impact of ICT tools or ICT systems in improving the health deliverables or deliveries in different climes, even third world countries, as the case might be. I remember there was a story of a Nigerian who actually conducted, I think, a brain surgery or something. I can't remember. It has to be Okonjo-Iweala's son or something, who did a brain surgery using technology interface. Well, it was wherever it was. The patient was somewhere else, and then that particular surgery was a successful one. And that's a Nigerian doing so well in other climes. But when we look at the country as it is, we hear a lot about telemedicine. What is telemedicine about?
Telemedicine is simply providing medical services at a distance. That is basically what it is. So in telemedicine, the medical professional, mostly the physicians and other healthcare workers, provide medical services in terms of medical consultation and diagnosis from a remote location far from where the patient is.
Oh,
So
great.
that's basically what
Would you say the COVID era or the COVID-19 impact to a large extent helped to improve the use of ICT, especially in Nigeria, basically?
Yes, to a large extent, the COVID-19 experience has improved ICT experience in Nigeria in the sense that during the lockdown, it was actually difficult for people to visit their doctors in person, especially for cases that did not require physical intervention. So, as a result, we realized that that drive for telemedicine has kind of improved in the country. So, because we know that telemedicine has quite a number of benefits.
Okay.
It has a number of benefits in the sense that, one, the physician is not fit. We have a huge shortage
That's
of
true.
physicians
That's true.
in Nigeria, about 3.9% physicians to 10,000 population, which is a far cry from what we need. And we know that these medical young physicians who, after graduation from the university, many of them are quick to leave the country. So there's a huge shortage, and telemedicine will, to a large extent, help. Also, we have specialist physicians who also are very few in certain fields.
Sure.
For example, like the telemedicine center we have for invasive fungal infection, there are very few in the country, and it is actually difficult for people from all over the country to come physically to receive medical consultation. But with telemedicine, that is very, very possible. It also provides imaging facilities and real-time imaging facilities such that the doctor can physically but remotely examine a patient even in the comfort of the patient's home.
Wow.
So it has a lot of benefits.
So what are the factors responsible why we're not adapting or adopting a lot of this, so to speak, knowing the fact that the medical professional ratio to the population is quite very, very, depressing in my own word, I would say. But it looks like we are not adopting it as fast as we should. Could it be because of the cost?
Well, cost is an issue. Cost is an issue, but it's not just the main issue. You know, the tendency of, although we know that we have poor infrastructural facilities, which is a major factor. Electricity supply in the country is not stable. So you need to provide an alternate source of uninterruptible electricity supply, and so many other things which need to be put in place to have a very effective telemedicine system. So the government needs to do more in terms of putting together the infrastructure that we need to be able to have so many of those facilities across the country.
Yeah, even talking about some of those infrastructure, when we imagine how internet services impacts telemedicine or ICT aspects of healthcare service provision, because I would imagine not just the electricity, some of these things should be conducted via the internet bandwidth as the case is.
Yes, you make use of internet, broadband internet facility. And that's also a challenge in the sense that knowing that the quality of internet services we have is usually not stable. You need to spend a lot of money on data to be able to get quality internet service. So that is also a kind of limitation, but it is something that is still very possible because internet penetration is actually very high in the country. At least based on NCC statistics, over 108 million persons have access to internet in the country. So that's a good number.
That's a good number to start with.
Yes.
All right, we're going to be going on a short break. Viewers, as soon as we're back, this conversation continues. Please don't go away.
Experience unlimited superfast internet access from Entel 4G. Entel. Live more.
Welcome back. If you've just joined us, I'm in the studio with no other person than Dr. NWANERI. Is an individual who is obviously distinguished, especially in the area of biomedical engineering here in Nigeria. We've been looking at the topic, the impact of ICT on the health sector. Before we went on the short break, we were talking about telemedicine and some of the factors that mitigate against, the efficiency of how we can apply telemedicine technology, so to speak, in the health sector. And so, Dr. NWANERI, one of the things that I'm so much concerned about has to do with oftentimes we're looking at the business angle of all of this. Biomedical engineering, it offers a lot of innovation in terms of some of those concepts that can be implemented to help deliver not just speedy healthcare services, but also look at exactly how some of those innovations can be adopted within our own tropical region. How far has biomedical engineering helped in terms of promoting innovation in that space? And what are those business opportunities that somebody can actually look forward to or explore, especially in a climate like us?
Yes, biomedical engineering is basically the application of technology to solving healthcare problems. Engineers are there to solve problems. So biomedical applies engineering to solving healthcare and biological problems. So that is basically what biomedical engineering is. So, and when we look at our hospitals, we know that for the purpose of medical diagnosis and treatments, there have been a lot of innovations that have helped to improve medical diagnosis, the diagnosis of various diseases. Biomedical engineering has helped to improve that. Most of the medical equipment we have in the hospitals are products of biomedical engineering. And to a large extent, quite a number of things have happened, not just in developed countries, but also in Nigeria. So a lot of biomedical engineering companies are really coming up within the country, and they are doing business and doing very well. So biomedical engineering is there to support medical professionals in the process of doing their job.
When we imagine what kind of investment outlay somebody has to consider, necessarily if you have to go into a business that is oftentimes centered on biomedical engineering, you obviously have to be an inventor or somebody who obviously has papers like yourself to be patented in order for you to be able to take advantage of that?
Well, you don't necessarily need to be an inventor to be able to do business in biomedical engineering. We have companies that do simply importation and sales, installation and maintenance of biomedical engineering. The sales aspect is there. And the costs depends on the aspect of biomedical engineering you are looking at. We have areas that have to do with disposable medical devices, which are quite not so expensive. But we have also areas that involve very large medical devices like an MRI machine that one could cost over 500 million.
For just one MRI machine?
Yes.
that's about $1 billion naira.
So that's why I said it depends on the aspect you are looking at. While we have aspects like your glucometer that costs less than 10,000 naira, your BP monitors that are less than 10,000 naira per each device, each unit of device. So those ones, definitely the money, the capital they need is quite different from the capital someone going into imaging devices actually needs. Interested.
So you actually can explore the entrepreneurial spirit in biomedical engineering services. Obviously, especially that still falls within the health sector's deliverables, as the case is. When we also look at diagnosis, for example, do we have enough diagnostic centers in the country?
Well, I will not say we have enough. We don't really have enough. When we look at the population, we have a quite huge population. And when we look at the hospitals, we have, apart from the tertiary health centers, like the teaching hospitals, the federal medical centers, and some of the other big private hospitals that have quite a number of medical equipment. We realize that most of the small private hospitals, the primary healthcare centers, do not really have adequate equipment and specialists to be able to man them
and specialists, you say.
Yes.
That's a fact. Where the argument or the debate comes forth that health is not supposed to be a strictly business affair. There's a social angle to it, as a matter of fact. Of what school of thought do you belong when it comes to that argument?
I belong to the school of thought of the social angle to it.
Okay.
And it's unfortunate that in terms of the health insurance, just about 3% of the entire country is on health insurance, less than 10%, which is a far cry. So spending is usually out of pocket for a lot of people, and you know that the level of poverty in the country is so huge. So to a large extent, we see a lot of people who die at the time they shouldn't have died if they actually get the required intervention. So I belong to the school of thought that the medical sector should be socialist, not more of...
Can that guarantee profits, as a matter of fact, for all the individuals or the people involved who are investing funds in as well?
Well, there should still be room for profit making. Great. There should be room for profit making, but they shouldn't see it as an opportunity to rake in more than raking so much at the expense of patients. Yeah, there should be a balance. There should be a kind of balance.
That balance for me is one of the things that I agree with you fulsomely. But as a way of wrapping up this interview, how well has research, obviously in that regard, done so much well for the health sector, especially with the research institute, the Health Research Institute here in Nigeria?
Yes, we have some data, available data, in terms of healthcare, in terms of diseases, various diseases and healthcare problems, which have been generated from research of academics within the country and research institutes. Quite a number of people are doing a lot in terms of that, and they are well published in the space, which you can easily be accessed.
But it seems more to me that a lot of the researches we depend on for some of our innovative solutions are actually researches from international bodies or from foreign countries. Hardly do we see so much from our own homegrown researches, even from the academics or whatever the case.
No, there are a lot of people doing a lot of research is going on in the academia. It's just that there's this gap between the industry and the academia, such that the industry does not really know how much is happening within the academia. So it seems as if nothing is happening, but quite a lot is happening in terms of research in the academia.
One of the things that I know in my own, from my own observation, has been the rampant increment in issues that has to do with kidney and liver. A lot of people oftentimes want to ascribe that to so much of the sachet alcohol, which obviously NAFDAC, as a matter of fact, seems to have taken a position on banning all of that. The people say it's oftentimes the traditional medicine that we take that has no quantity measurement, so to speak. So what we imagine that if there are enough researches to actually, prove that this is either true or false, perhaps we'll be able to create an industry that is going to be well known, and that itself can help in terms of export, which can help us earn certain foreign revenue as well. So I want to believe that, and it's not being argumentative, I want to believe that so much of that area in terms of, especially our traditional medicine, we don't see so much of that being tapped into.
Well, in terms of traditional medicine, I think NAFDAC is doing something within that area now, and they actually need to do more, because there is a lot of benefits from the traditional medicine. It's just that in terms of toxicity of many of those herbs, most of those inventors need to specify the toxicity and so many of those other things that are required to be able to make use of them and make them accessible globally. Then in terms of other inventions, when the
onslaught was so high,
ravaged by COVID-19 in 2020, we were involved in quite a number of projects to be able to address that, which I'm part of the team that worked on the Unilag ventilator.
Oh, great.
So that project now is being supported by Lagos State Science and Research and Innovation Center.
Great.
So at this stage, we are in the process of animal trials.
Oh, great, great.
Which, when we were able to do that successfully, we will move to the other stages of clinical trials and all that.
Oh, congratulations on that. That is a very good story. Yeah, that's a good tale. And I'm very sure NTA is going to be willing to work with the University of Lagos as well as with Lagos State government to see how we can project more of these kinds of innovations that are homegrown. We need to begin to celebrate our own.
Yes. So a lot of researchers are working. We just need support.
Great. From
government, from industry, to be able to do better.
Done. All right.
Then the infrastructural challenges are there. As a researcher, you need a good working environment, you need stable electricity, you need other things to be in place for you to be able to do your work. But when those things are not there, there are kind of limitations.
They are. All right. Thank you very much, sir. It's been a wonderful, wonderful engagement, and I've learned a lot. And I hope perhaps in the future, when we extend another hand of invitation, we'll be glad to have you honor our invitation.
Thank you very much.
Thank you very much.
Thank you very much.
Viewers, there's so much we can take on this segment of our interview, looking at the impact of ICT on the health sector. And definitely Dr. NWANERI has helped us appreciate so many aspects of biomedical engineering where business opportunities are quite abound, and for you to take up advantage of some of this. Please stay tuned. Business Matters continues. Biomedical engineering definitely offers a lot of opportunity for us to be able to explore, certainly also engage our local researchers and see how we can bring out innovations as well as solutions that can be very, very applicable to our own special healthcare issues. And this tells us the fact that opportunities abound in Nigeria. How much we're going to take an advantage of that is what the ICT industry is here to offer to us. This is so much we can bring to you on Business Matters. Please join us on all our different platforms as well when we bring so much of Business Matters content across to you. My name is Stephen Ipalobo. Bye for now.
Business. Business.